We have learned a lot about COVID-19 in the almost 2 years of battling it. Two of the phrases we hear a lot are fully vaccinated and breakthrough case. The U.S. CDC determines those definitions. Right now, fully vaccinated means someone who has had either 2 shots of Pfizer or Moderna or 1 shot of Johnson & Johnson. The other term, breakthrough case, means when someone who is fully vaccinated tests positive for COVID-19. Northern Light health leaders say we could be rethinking these definitions very soon. Breakthrough case. Once a scary term, meaning the virus somehow evaded the protection of the vaccines. Remember the goal of the vaccines? Preventing death or severe illness that would send someone to the hospital. mRNA vaccines like Pfizer and Moderna are more than 90% effective at preventing these, according to the U.S. CDC. Johnson & Johnson's shot is 89% effective against hospitalization, 83% effective in preventing death. That means breakthrough cases that lead to death and hospitalization are rare, but they can happen. Doctors in Maine are noticing a trend.
And we have seen that for those that are more than 5 months out from vaccination, there's a clear correlation between the number of individuals that experience breakthrough cases and the time from their vaccination.
Those data show the longer it's been since you got your last dose, the more likely you are to catch COVID. That's because we now know our protection from the vaccines wanes over time. Northern Light Health data show most people who are vaccinated but still get hospitalized are over age 60. Most of those people got their first series of shots almost a year ago.
And those that are boosted do have a protective effect against breakthrough illness with COVID-19.
That's why the US CDC bumped up the timelines for people to get boosters. It's now urging people who got either Pfizer or Moderna vaccines to get a booster 5 months after their final shot. Those who got J&J should get a booster 2 months after their final shot. Keep in mind, 75% of Mainers who can get the shot are fully vaccinated. That's more than 968,000 people. So far, the Maine CDC reports 26,000 breakthrough cases, but only 532 needed hospitalization. 532 vaccinated people hospitalized out of more than 968,000 people fully vaccinated? That's 0.05%. 248 fully vaccinated people have died. That's 0.03%. And we don't know if those people have underlying conditions that could affect their ability to recover.
So it's not impossible to suspect that you will still see individuals that have been boosted that may present with breakthrough cases, but it's even far more effective at preventing severe illness and hospitalization. COVID vaccines are highly protective against severe illness, and that effectively gets patients out of the hospital, staying home, able to care for themselves, and preserves our ability to care for patients overall.
Now, we cannot ignore an important fact. The number of people in the hospital, both unvaccinated and fully vaccinated, is rising. Dr. Marston said that because we can see how necessary boosters are, he would not be surprised if the U.S. CDC eventually changes the definition of fully vaccinated to include booster shots.